all, welcome to my channel Vet Lecture. Today we will discuss multiple choice questions on veterinary pharmacology. Question number first. One of the following is the proton pump blocker prescribed at gastric ulcer. Options A, omeprazole. Options B, metoclopramide. Option C, mesoprostol. Options D, sucralfate. The right answer is option A, that is omeprazole. Okay. Proton pump blocker, which is prescribed at gastric ulcers, that is omeprazole. Okay. And if we see that anti-ulcer drugs, then we found there's a three types of anti-ulcer drugs. That is a proton pump inhibitors. That is the omeprazoles, lansoprazoles, and rabiprazoles. Those drugs which suffix is prazoles comes under that proton pump inhibitors. And second group is that H2, that is histamine receptor antagonist, which mainly include that famotidine, ranitidine, cimetidine, and lafutidine. That is a suffix tidine refer to that H2 receptor antagonist. Among this all, that H2 receptor antagonist, famotidine is that most potent one. And third group is that mucosal protective drugs, which mainly includes rabamipid, teprinon, polaprizink, sofalcon, alginate sodium extra. Okay. Here are some other facts related to that these anti-ulcer drugs. That is a stimulation of a cholinergic, that is a muscarinic M1 receptors and histaminergic H2 receptors, will lead to increased gastric acid secretions. Okay. And this dicyclomine is used to relieve gastrointestinal muscle spasm. Okay. And if we see that this H2 receptors antagonist, which is that cimetidine, ranitidine, famotidine, these are that selective H2 receptor antagonist. Okay. And as comparison to that ranitidine, if we see that ranitidine as comparison to that cimetidine, ranitidine is preferred over that cimetidine because it does not inhibit that hepatic microsomal enzyme, does not also increase that prolactin rebel, as well as it is much less and convenient to patients. Okay. And this H2 receptor antagonist are also indicated in case of that reflux esophagitis cases, and when there is a acute ulcerative colitis, and also when there is a duodenal ulcers extra. Okay. And if we see that the work pattern of that histamine H2 receptors, then it causes that increase in cyclic adenosine monophosphates in cells. It also increase in gastric acid secretions, also modulate that T lymphocytes activity and vascular dilations. Okay. Questions number second. Macrolide contraindicated in coolie and its crossbreed dog. Options A, that's praziquantel. Options B, levamisole. Option C, closentel. Options D, ivermectin. The right answer is option D, that is ivermectin. Okay. Ivermectin is a group of macrolides which is contraindicated in coolie breed, and it's also a crossbreeds dog. That's results of that mutation of that multi-drug resistant first gene. Okay. Note that the blood-brain barrier of coolie and its crossbreed dog are deficient in PGP protein. Okay. Questions number 3. All but not one of the following is a chelating agent. Options A, BAL. Options B, desferoxamine. Option C, calcium sodium EDTA. Options D, 2-PAM. Okay, the right answer is options D, that is 2-PAM. Okay. That is a pralidosim. Okay. And a pralidosim is that antidote of organophosphate anticholinesterase pesticides, and it's actually work by reactivating that cholinesterase enzyme so that they can break down that cholinesterase acetylcholine at the postsynaptic site. Okay. Similarly, methine blue, which is the active the active form of methyl blue is leucomethylene, which is the antidote of nitrate toxicity. Actually, convert that methanoglobin to that hemoglobin. Okay. And and if we see that ascorbic acid is also very effective for the conversion of methanoglobin to hemoglobin in ruminant. Okay. And if we see that working pattern, then of the antagonist, then we found that the calcium sodium EDTA, which is the antidote of lead toxicity, it's actually work by mean of chelation. Okay. And similarly, D-penicillamine, which is the antidote of copper toxicity, it's also work by mean of chelations. Similarly, BAL, that is British anti-levicides, which is also antidote of arsenic toxicity, is also that chelate that toxic substance. Okay, and while activated charcoal, which is the antidote of DDT, it's a work by mean of an adsorption mechanism. Okay, similarly, fluoroacetate, which is given as an antidote of acetate poisoning. It's actually the competitive substitutions of that acetate. Okay, uh, and that if we see that the product which is formed by that interaction of that silver nitrate, which is a toxicant, and if we given as a antidote of that silver nitrate, that is a sodium chloride, then we found there's a formation of a silver chloride. Okay, and the product formed by the interaction of a fluoride, which is toxicants, and the antidote of a fluoride, that is calcium lactate, that is a calcium fluoride. Okay, similarly, the product formed by interaction of strychnine, that is toxicants, and its antidote, that is tannic acid, then we found that strychnine tannate. Okay, the product formed by interaction of a cyanide, that is toxicant, and its antidote, that is methanoglobin, then we found that's a cyanomethanoglobin. Okay, questions number 4. Bactericidal action of one of the following is time dependent. Options A, enrofloxacin. Options B, penicillin G. Option C, streptomycin. Options D, metronidazole. The right answer is options B, that is a penicillin G. Okay. Beta lactam, that is a penicillin glycopeptide linezolid macrolide. They have actually a time dependent bactericidal activity. That's mean that their bactericidal activities actually depend on the time at which the concentration of the drugs remain above that minimum inhibitory or that minimum killing concentrations. Okay. Questions number 5. Competitive antagonist of benzodiazepine receptor. Options A, 4-aminopyridine. Options B, gabapentin. Option C, yohimbine. Options D, flumazenil. The right answer is options D, that is flumazenil. Okay. The competitive antagonist means that those antagonist, if we that which can be that competitive. So in case to remove the effect of that antagonist by increasing the that amount of that agonist, we can remove that antagonist from the receptor side. Okay, so these are the competitive antagonist. Competitive antagonist of benzodiazepine. Benzodiazepine are actually those that drugs which mainly include like diazepam, lorazepam, and clonazepam. They are mainly given in case of that to remove that anxiety. Okay. And the competitive antagonist of this benzodiazepine receptor, that is a flumazenil. And if we see that's benzodiazepine receptor agonist refer to those drugs which has that intrinsic property as well as that their intrinsic property and affinity to, okay, toward that receptors, and they that when they bind to that respective receptor, they increase their activity. Okay. That agonist of that benzodiazepine receptors are the diazepam, lorazepam, clonazepam, midazolam. Okay. And if we see that full agonist on case of opioid receptors are mainly related to that pain receptor. Okay. That full agonist on opioid receptor, that is meperidine. Competitive antagonist on opioid receptor, that is naloxone. Okay. Beta receptor agonist, beta receptors are actually found in that lungs and heart. Beta 1 actually found in that heart, while beta 2 receptors actually found in that lungs. Okay. And the beta receptor agonist, if we see, that is albuterol, metaproterenol, pirbuterol, charbutaline, levabuterol. Okay. And if you see that's a partial agonist on beta angiotensin receptor, then the example of that partial agonist on beta angiotensin receptor, that is a saralacine. Okay. Similarly, non-competitive antagonist. Non-competitive antagonist means those antagonists with which that our agonist cannot be compete. Okay. Atoms that this non-competitive antagonist bind with that receptor, then although while increasing the larger amount of that agonist, we cannot replace it. Okay. The non-competitive antagonist on alpha adrenergic receptors, that example is that phenoxybenzamin. Similarly, a selective adrenergic alpha 2 blocking agent. Alpha 2 receptors are actually found in case of that Alpha 2 receptors mainly found that as presynaptic regions, okay, and that is euhimbine. Okay, similarly, selective postsynaptic alpha receptor blocking agent, that is a prazosin. Uh, the drugs which block both that adrenergic alpha and beta receptor, that is levetolol. Okay, selective adrenergic beta 2 receptor agonist, that beta 2 receptors mainly found in lungs, that is a salbutamol. Okay, similarly, selective adrenergic beta 2 receptor antagonist, that is butoxamine. Selective adrenergic beta 1 antagonist, beta 1 receptor actually found in heart, okay, that is atenolol. Okay, if we see that example of serotonin receptor antagonist, that is a cyproheptadine. Similarly, example of histamine receptor antagonist, that is metiamide. Adrenergic beta blocker has a marked membrane stabilizing actions. That is example is that propranolol. Okay, similar the adrenergic beta receptors is said to be an enzymes that is known as adenyl cyclase enzymes that's linked with the adrenergic beta receptors. Okay, there's a note that agonist is those which possess both that affinity and intrinsic activity. They have affinity to bind with the receptors and to cause that intrinsic activity, while antagonist possess only affinity to binding with the receptor, but they does not possess that intrinsic activity. They just prevent that agonist to bind toward that to that receptor site. Okay, questions number 6. L-type calcium channel blocker, which is used to prevent a supraventricular tachycardia. That is options A, quinidine. Options B, amlodipine. Option C, captopril. Options D, amrenon. The right answer is options B. That is amlodipine. Okay, L-type calcium channel blocker, which is actually used to prevent supraventricular tachycardia. That is the amlodipine. Note that if we see that the three all options, then quinidine is actually that anti-arrhythmic drugs, which is actually used to treat irregular heartbeat. Similarly, captopril is used to treat that high blood pressure condition, that is hypertension conditions. Similarly, ambrinon, it's the type 3 phosphodiesterase inhibitors. It is actually used for short-term treatment of heart failure. Okay. Questions number 7. Glucuronide formations, which is a process of that drug detoxification mechanism, is actually poor in options A, dog. Options B, cat. Option C, pig. Options D, cattle. The right answer is option B, that is a cat. Okay. Glucuronide formations is a drug detoxification mechanisms is poor in cat. Drug undergoes glucuronide conjugations are that morphine, acetaminophen, NSAIDs, benzodiazepine, extra. Okay. Questions number 8. Sialic acids contained in glycoprotein hormone determine its options A, biological activity. Options B, receptor binding. Options C, half life. Options D, in vitro stability. The right answer is option C, that is a half life. Okay, that sialic acids contained in glycoprotein hormones actually determine its half life. Okay, if we see that sialic acids are 9 carbon atom sugar, which is usually presents as terminal residue of glycoprotein and glycolipid, which mainly play an important role in infections preventions. And if we see that example of this glycoprotein hormones, then these are the follicle stimulating hormone, thyroid stimulating hormones are the example of a glycoprotein hormones. Okay. Questions number 9. An active principle in rhizomes of turmeric plants. Options A, piperine. Options B, azadirachtin. Option C, curcumin. Options D, quercetin. The right answer is option C, that is a curcumin. Okay, active principles which is present in rhizomes of turmeric plant, that is curcumin. Okay, while the active principles which is present in black pepper and long pepper, that is piperine. Okay, the active principle which is present in neem, that is a azadirachtin. Options D, that is a quercetin, is a plant flavanol. Which is found in many fruits, vegetables, leaves, seeds, and green. Capers, red onion, and kali are the common food containing it. Okay. Questions number 10. More than 50% of drugs undergo metabolism through options A, CYP1A1, options B, CYP3A4, option C, CYP2D6, options D, CYP2C9. The right answer is option B, that is CYP3A4. That more than, if you see, that's more than 50% of drugs that undergo metabolisms through that CYP3A4. These are that the enzymes of liver, that cytochrome P450A3A4 as an important enzymes which is found in liver and also found in intestine. It's mainly oxidize small foreign organic molecules such as toxins and drugs, and so they can remove from the body. And it's highly homologous to that CYP3A5. Okay. Similarly, CYP1A1 is responsible for the metabolic activation of that procarcinogen, that is a polycyclic aromatic hydrocarbon and aromatic amines, into that reactive metabolites, and it also participates in the metabolism of steroidal hormones like estrogens. Okay. Similarly, CYP2D6 is a protein coding gene. It's a gene which is associated with like drug metabolisms, poor conditions, CYP2D6 related, and neuroleptic malignant syndromes. Okay. And CYP2C9 is actually involved in protein processing and transport. It provides instructions for making and enzymes that found in cell structures, that's called endoplasmic reticulum. Okay. Questions number 11. The mathematical descriptions of change in concentration of drugs or their metabolite in body is called options A, pharmacometric, options B, pharmacokinetics, option C, chronopharmacology, options D, pharmacodynamic. The right answer is option uh, the right answer is option the right answer is actually that pharmacokinetics. Okay, the mathematical descriptions of change in the concentration of a drugs or their metabolism in body, that's pharmacokinetics, actually deal with what body does to that drugs, and while that drugs does to that body comes under that pharmacodynamic. Okay. Questions number 12. Carbon tetrachloride is primarily options A, neurotoxicant, options B, nephrotoxicant, option C, hemotoxicant, options D, hepatotoxicant. The right answer is options D, that is a hepatotoxicant. Carbon tetrachloride, which is a that hepatotoxicants. Since this carbon tetrachloride is used as like used as a green fumigant and also used to clean that for the human industry. It's an non-inflammable colorless liquid with a heavy sweet odor. Okay. And the hepatic injury which is associated with this carbon tetrachloride is actually mediated by its metabolite, that is trichloromethyl free radical as well as trichloromethyl peroxy free radical. Questions number 13. Example of an pyrethroid compound. Options A, parathione. Options B, warfarin. Option C, cypermethrin. Options D, indosulfan. The right answer is option C, that is cypermethrin. Okay. Pyrethroid, that is man-made pesticides, is actually produced from that chrysanthemum flowers. The example of these pyrethroids is like permethrin, rasmethrin, sumethrin, cypermethrin. Okay. The synergist that is added to this pyrethroids compound in order to enhance its activity, that is piperonyl butoxides. Okay. Similarly, organophosphorus compound, which is used as an insecticide. Example of this organophosphorus compound, that is parathione, which is potent one, and malathione. The toxic effect of this malathione in mammal is due to the formation of a malaoxone. Okay. Organophosphorus compound that interact with both steretic and anionic site of this acetylcholine esterase enzyme is ecothiophate. Okay. And next is it organochlorine compound, which is also used as insecticide, that does not accumulate in the body, that is indosulfane. Okay. And if we see that example of organochlorine, that benzene hexachloride is example of organochlorine. Note that a carbamate, which is a pesticides, act by interacting both that steric as well as anionic site of acetylcholine esterase. Okay. Questions number 14. The first pharmacopoeias was compiled by options A, Englishman, options B, Egyptian, option C, German, options D, American. The right answer is option C, that is a German. The first pharmacopoeia was compiled by a German. Okay. And the first laboratory exclusive to the study of pharmacology was established by Rualf Bulksim. Okay. And if we see that's creator of this modern scientific pharmacopoeia, that is Charles Rice. The father of pharmacology is Rudolf Buchems. The term anesthesia was coined by Oliver Holmes Wendell. Questions number 15. Most of the dose of aspirin, that pK value of aspirin is 3.5, are absorbed from the small intestine because options A, because the pH of small intestine is acidic. Options B, the pH of small intestine is alkaline. Option C, because that absorptive surface area of the small intestine is large. Or options D, none. The right answer is options C, that is the surface area is large. Okay. Actually that the both the factor, that is the, we all know that the drugs absorbed in their anionic form, okay, anionized form, and so that acidic drugs require that acidic pH for its absorptions. Okay. But in case of small intestine, they have the alkaline pH, so the drugs remain in that in that that their ionized form, which is not in absorbable form. Okay. Allah, here are some factors which is affecting that absorption of that the drug. That is the factor which is related to drugs, and the factors which is related to that body. Okay. And the factor that is related to drugs, that is lipid water solubility coefficients. When there's a lipid water solubility coefficients is high, that indicate that the drugs is more lipid soluble, since they promote the diffusion of the drugs throughout that blood vessels. Okay. And that increases that absorptions. Similarly, second is that molecular size of the drugs. Smaller the size of the drugs, rapid the absorptions. Similarly, the particle size of the drugs, smaller the particle size, rapid the absorptions. Similarly, the degree of ionization. Okay, we know that unionized form drugs absorb rapidly. Okay. Second is physical form, like gaseous form drugs absorb rapidly as compared to the liquid form, as compared to the solid form. Okay. Chemical natures, the drugs, the like certain drugs, such that ionized in certain pH lead to that they are lesser in absorptions. Okay. Similarly, doses form, tablet, capsules, and that liquid form. So we all know that the liquid form is more absorbable as compared to that other form, and the coating of that the tablet may that decrease the absorptions from the site. Okay, you know. So next is that formulations that include that formulations refer to that in drug, there's a two components are actually in case of medicines, there's a two components actually included. That's a active moiety, that's a drug, and then some certain inert substances is added to it, you know. And this inert substances may that alter or halter their absorptions, or may that promote their absorptions. For example, like sodium, uh, including the sodium in the drugs, which can interact to decrease its absorptions. Okay. Similarly, that second is that concentrations, like higher the concentrations of the drugs, more flux across the membrane. Okay, lead to that more absorptions. And if we see that factor which is related to body, then the absorptive surface area, okay, the larger the absorptive surface area, that promote the absorption of the drugs. Okay. So that most of the drugs, that absorptive site is a small intestine, although that aspirin is that acidic drugs, and because of the larger surface absorptive surface area of that small intestine. Second is like vascularities, that the area or that organ which is rich in vascularities, there's absorptions is also there is rapid. Okay. And next, another factor is like pH, that the pH and pK value of the drugs to the both related to each other for the absorption of the drugs. Second is presence of other substance, some substance, like when we eat something along with that food, along with the drugs, that may alter their absorptions. Okay. Next is that GI motility is another factor. Sometimes GI motility is rapid, lead to that excretion of a drug faster, alter their absorptions. Similarly, functional integrity of absorptive surface area, sometimes because of certain disease, yeah, certain accidents, that functional integrity of that absorptive area get altered, lead to that decrease that absorptions. Similarly, certain disease conditions also that affect the absorption of the drugs. Okay. Questions number 16. Which of the following is most applicable for distribution of the drug from blood? Options A, differences in blood flow. Options B, pK of the drug. Options C, the extent of the protein binding. Or options D, all. The right answer is options D, that is all. Okay. The factors which affecting the distribution of the drugs, then if we see that the factor which is related to drugs, like same as like lipid solubility, that increase the lipid solubility, that also increase the distribution of the drugs. Second is like molecular size. Higher the size of the drugs lead to less distribution of the drugs. Degree of ionizations, we all know that unionized form absorbed, ionized form rapidly distribute too. Okay. And cellular binding, the drugs which are sometimes bind to that certain cells, or like certain drugs when they are like ionized form, they enter to the certain type of cells, or if the cell has certain type of pH, which lead to make drugs that ionized form, so they cannot escape out from that the cells, lead to that cellular binding, which decreases its distributions. Okay. Second is like duration of actions, like some drugs which bind to that protein binding and lead to that cellular binding, which alter their that excretion of that drugs, lead to that increase the duration of action of that drugs, that will increase that half-life of the drugs. Okay. Next is therapeutic effect, like bisphosphonate, which bind with that bone matrix cells and stain in them, used in the treatment of osteoporosis. Similarly, toxic effect like chloroquine deposited in retina, tetracycline, which actually bind with the bone material. Okay, they are the toxicity effect of that tetracycline and that chloroquine. Okay. Another factors that related to body, like vascularities, those organs which have that profuse blood supply, the blood passes to them very rapidly, lead to that distributions rapid in those organs, as a comparison to those organs which are less profuse. Okay. Second is like transport mechanism. For example, different compartment, there's a different mechanisms. Lipid soluble drugs have that passive transport, while active transports occurs where carrier protein are present. Similarly, like blood barrier is another factor. Certain drugs able to cross blood-brain barrier, blood neuronal barrier, their distributions is that beyond that neuronal area, their volume of distribution is large. Okay, as compared to those which doesn't cross. Okay. Second is plasma binding protein, we already discussed that. Second is free and bound form of drugs. We know that free form of drugs are actually that pharmacologically active drugs, and also they are prone to that metabolisms and excretions, but bound form of drugs remain in a body for a longer period of time. Okay. Similarly, drug interactions, certain drugs bind with another, like certain drugs lead to that addition in effect when given together. Certain drugs lead to synergic effect when given together. Certain drugs antagonize their effect, so this also affect their distributions. Certain disease conditions which affect the distribution of the drugs pattern. If we see that volume of distributions, that volume of distribution is that the total dose of the drugs divided upon that the plasma concentrations of the drug. Okay, the amount of the drugs per ml of plasma, the dose of the drugs divided by the amount of the drugs per ml of the plasma, then we get that volume of distributions at which the drugs get distributed. Okay. Questions number 17. Solution that contain bacteriostatic agents. Options A cannot be tested for sterility. Options B must be diluted beyond the bacteriostatic levels for sterility test. Option C do not require sterility test. Options D none of the above. The right answer is options B, that is must be diluted beyond the bacteriostatic level for sterility test. Okay. A solution that contain bacteriostatic agents must be diluted beyond the bacteriostatic levels for sterility test. Okay. Questions number 18. The bond strength of the hydrogen bond is options A 50 to 150 kcal per mole, options B 2 to 5 kcal per mole, option C 10 to 20 kcal per mole, or options D less than 1 kcal per mole. The right answer is options B, that is 2 to 5 kcal. Okay. The bond strain of the hydrogen bonds 2 to 5 kcal per mole. The hydrogen bond are actually classified based on their strain of interactions into three classes, that is weak hydrogen bond strains, moderate hydrogen bond strains, and strong hydrogen bond strains. The weak hydrogen's bond involved like less polar group as a proton donor, like carbon, or less polar acceptors like nitrogens, and the bone strength ranges from 0.5 kcal per 5 kcal per mole, while moderate hydrogen bone strength ranges from 5 to 15 kcal per mole. Strong hydrogen bone strength ranges from 15 to 40 kcal per mole. Okay. Questions number 19. Which of the following statement is most correct for free form of drugs in the blood? Options A, they are pharmacologically active and but not diffusible. Options B, they are pharmacologically inert but readily diffusible. Option C, they are no available for metabolism as well as they are no non-diffusible. Options D, none. The right answer is options D, that is none. Okay. Here the differences, if we see the differences between bound and unbound form of drugs, then that unbound form of drugs, that is free form of drugs, are non-diffusible forms, while bound form of drugs are diffusible form. Okay, 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 okay. Uh, uh, okay, this may something change like that. Free form of drugs are actually diffusible form, while bound form of drugs are that non-diffusible forms. And free form of drugs can cross endothelial barrier, but bound form of drugs cannot cross endothelial barrier. Similarly, free form of drugs can combine with the receptors, are in active form and also available for metabolism and excretions, and they have a short half-life, while that bound form of drugs are inactive forms and they cannot combine with the receptor, they cannot show their pharmacological actions, and they are not available for metabolism and excretion too, and they have long duration of actions, that's long half-life. Okay. Questions number 20. Eber's Papyrus is an old compilations of disease conditions and prescriptions for medicament. It was written about options A 1500 BC, options B 2000 BC, option C 2200 BC, options D 2700 BC. The right answer is option A, that is 1500 BC. Eber Papyrus is an actually old compilation of disease conditions and prescriptions for medicament. It was written about 1500 BC. Okay, Eber Papyrus is a preserved medical document from that ancient Egypt. It's longer and more complete than the Edwin Smith Papyrus, and it's about as old. And it's a collection of a diverse medical texts that are offered the most complete record of Egyptians' medicines. Okay. Questions number 21st. Which of the following is most applicable for the variation in the doses of the drugs? Options A, species of animal. Options B, the intended effect of the drugs. Option C, the individual susceptibility to the drugs. Options D, all. The right answer is options D, that is the all. Okay. The factor which affecting the dose and action of the drugs, then if we see that's young age, like a young one require less dose as comparison to the adult one. If we apply that either Young's formula, which is actually based on age, or Clark formula, which is based on weight for calculating the dose, but formula based on body surface is actually reliable one. Okay, for the dose calculations. Second is that if we see that sex, then female adult required a smaller dose as compared to that male due to the presence of more body fat in female. Okay, body weight, lower the body weight require the less amount of a dose as comparison to that larger the body weight. And next is severity of disease. More severe disease require more doses, like dull headache relief by a single tablet, whereas a severe headache require 2 to 3 tablet of same drugs. But not it is true in all cases. In case of iron deficiency anemia, dose of iron salt administered orally remain same irrespective of that severity. Okay. Similarly, health and nutrition status, then debilitated and anemic patients are more sensitive to the toxic effect of the drugs, require a smaller dose as compared to that healthy animal. Okay, pathological state, like certain organs which are responsible for that metabolism excretion for drugs, like liver and kidney, when they are hampered, such patients require less amount of a dose of drugs as compared to that healthy one. In similarly, that tolerance, low doses of drugs lead to that tolerance effect in that human, okay, or that animal. Simultaneous administration of two or more drugs, certain drugs cause addition, certain drugs cause synergisms, and certain drugs cause antagonism actions. Okay. Route of administrations, like IV route require a lower amount of dose as compared to that other route. Okay. Time and frequency of the drug administrations, another is idiosyncrasy, another factors like allergy. Okay. Questions number 22. Abnormality of the genetic material, gene chromosomes, caused by the drug is called options A, mutagenesis, options B, oncogenesis, option C, teratogenesis, options D, all. The right answer is options A, that is a mutagenesis. Abnormalities of the genetic materials, like gene chromosomes, which is caused by the drugs, is called mutagenesis. while oncogenesis, tumorigenesis, or carcinogenesis is the terms which is referred to the formation of the cancers, whereby the normal cells are transformed into the cancer cells. While teratogenesis occurs when the drugs taken during the pregnancy times, early stage of pregnancy, which is called the developmental abnormalities in the fetus. Okay. Questions number 23. Double reciprocal plot has been applied widely to the analysis of options A, competitive antagonism, options B, non-competitive antagonism, option C, both of the above, options D, potential of agonist. The right answer is option C, that is both of the above. Okay. Double reciprocal plot has been applied widely to the analysis of both that competitive antagonism as well as non-competitive antagonism. Okay. The double reciprocal plot, also known as like Line-Weaver-Burke plot, it is created by plotting the inverse initial velocity as a function of that the inverse of the substrate concentration. Okay, and this Line-Weaver-Burke plot is convenient because it allow us to determine the exact value for that Michaelis contest and that maximum velocity. Questions number 24. After a thalidomide disaster, which of the following animal tests are felt mandatory for new drugs? Option C, administration of a drugs to both sexes before mating. Options B, administration of a drugs throughout pregnancy. Option C, observation of the animal from birth to maturity, including the above two. Or option C, none. The right answer is option C, that is a observation of animal from birth to maturity, include the above two. Okay, after thalidomide disasters, following animal tests are felt mandatory for the new drugs, like administration of a drugs to both sexes before mating, administration of a drugs throughout the pregnancy, and observation of an animal from birth to maturities. Okay, if we see that's thalidomide, then thalidomide is a drug which is actually used for the treatment of nausea in a pregnant woman, which lead to result in that severe birth defect in thousands of children. Okay, after that, the happening, the animal tests are done to that new drugs before that given to that human being. Okay. Questions number 25. Sublingual administrations can be adopted for the following drug. Options A, glyceryl trinitrate. Options B, methyl testosterone. Option C, oxytocin. Options D, all. The right answer is options D, that is all. Okay. Sublingual administrations refer that to the placement of the drug under the tongue, and this sublingual route actually bypasses the first pass metabolisms and hence facilitate rapid absorption of the drugs into the systemic circulations using blood vessels. Okay. And if you see the example of sublingual administered drugs that include glyceryl trinitrate, methyl testosterone, oxytocin, extra, and this sublingual drug administrations give quick onsets of action. Okay. Questions number 26. Following statement true regarding rectal administration of a drugs. Option A, it's a convenient mode of administrations in presence of vomiting. Options B, rectal administration produces systemic effect. Options C, it bypasses first hepatic metabolism. Or options D, none. The right answer is options A. It's a convenience mode of administrations in presence of vomiting. Okay. Rectal administration of the drug is convenient mode of drug administrations in those patients which have that vomiting or nausea. Okay, this rectal formulations are based on convenient doses forms such as like suppositories or enemas. Okay, questions number 27. Following is not true regarding oral administration. Option C, all soluble drugs are absorbed from GI tract. Options B, benzyl penicillin is absorbed from stomach. Option C, both A and B. Or option C, none. The right answer is option C, that is both A and B. Okay. If we see that fact which is related to that oral drug administration, then it is the oral drug administration is more convenient, most cost effective, most commonly used medications route of administrations. Okay, and the primary site of absorption of a drug is small intestine, and the bioavailability of that medication is actually influenced by the amount of a drug absorbed across the intestinal epithelium. Okay. Questions number 28. Drug administrations by inhalations. Options A is only possible for gases and volatile liquid. Options B is for systemic or local effect. Option C lead to cough and bronchospasms. Or option D will have bronchiolar effect only if the particle size is 40 μm or less. The right answer is options B, that is for a systemic or local effect. Okay, drug administrations by inhalation is for a systemic or local effect. Okay, if we see that's a drug administration by mean of inhalation, that the drug administrations by inhalations through the mouth must be atomizides into smaller droplet than those administered by the nasal route, so that the drugs can pass through the windpipe and into the lungs. And how deeply the lungs they go actually depend on the size of that droplet. Okay, and inhale medications route can be utilized to administered albuterol or corticosteroid such as fluticasons, and also to deliver inhale anesthetics to the patients. Okay. Questions number 29. The oral bioavailability is a ratio between options A, the oral dose and IV dose, options B, maximum plasma concentrations oral and the maximum plasma concentration IV, option C, time maximum oral and time maximum IV, or options D, area under curve oral and area under curve IV percentage. The right answer is options D, that is the area under curve oral and area under curve IV percentage that give the bioavailability of the drugs. Okay. The questions number 30. The following is true regarding plasma protein binding. Options A. Acidic drugs are bound to the albumin fractions. Options B. Basic drugs are not bound to the protein. Option C. Highly plasma protein bound drugs have short plasma life. Or options D. That plasma protein binding sites are non-specific. The right answer is options A. That is acidic drugs are actually bound to the albumin fractions. Okay. Acidic drugs are bound to the albumin fractions, which actually lead to that increase the plasma half-life of the drugs. That's must for today. Thank you.